I'm so sorry for the delay. I had a bit of a situation with the previous patient that looked longer than expected. Thank you for your patience. All right, now, what brings you in today? No problem, doctor. I've been having this really bad toothache for the past few days, but it's gotten worse. The pain is also spreading to my head, and it's been giving me headaches. That sounds painful. I'm sorry to hear that. Let's start by getting some more details so I can understand what's going on. How long have you had the toothache? It started about 4 days ago. At first, it was just a mild pain, but by the second day, it got a lot worse. Now it's almost constant, and I can barely eat or sleep because of it. I see. And you mentioned that the pain is also affecting your head. When did the headaches start? The headaches started 2 days ago. It's like the pain from my tooth is moving up into my head. And sometimes it hurts even more than the toothache itself. It hurts a lot. That's not good. Have you taken any painkillers or other medication to try and manage the pain? Yes, I've been taking some over the counter painkillers, but they don't seem to help much. The pain goes away for a little while, but then it comes back just as strong. That's good information to know. Have you noticed any swelling around the tooth or in your gums? Maybe even some sensitivity to hot or cold food and drinks? Yes, there's definitely some swelling, and the tooth is really sensitive. Even when I drink water, it hurts. And when I chew on that side of my mouth, it's almost unbearable. It sounds like you might have an infection or a deep cavity that's affecting the nerve. We'll need to take a closer look to be sure. But before I examine your tooth, I'll need you to follow a few steps to prepare. Alright, give me a second. First, I'm going to give you a bib to wear so we can keep your clothes clean during the examination. Alright, next, I'll need you to rinse your mouth out with this antiseptic solution. It will help clean your mouth and reduce any bacteria before I start the examination. After you've done that, I want you to recline back in the chair and get comfortable. I'm going to lower the chair and adjust the light so I can get a good look at the tooth that's causing you trouble. Alright? I'll also need to put on some gloves and a mask for hygiene purposes. And then I'll start by gently examining your teeth and gums. I'll be using a small mirror and a probe to check for any signs of decay or infection. If at any point you feel any discomfort or pain, just raise your hand and I'll stop immediately. Alright? Do you understand? Okay, doctor, I understand. I'm going to do what you say. One moment. Great. I'm going to start now. Just try to relax and take deep breaths. We'll figure out what's going on and get you feeling better soon. Don't worry. I need you to open your mouth as wide as you can so I can get a good look at that troublesome tooth. Remember, if you feel any pain or discomfort, just raise your hand and I'll stop right away. I see some significant swelling around your gums, especially near the tooth you mentioned. There's also a large cavity here, and it looks like the decay has reached the nerve, which is likely causing the intense pain you're feeling. Okay, I'm going to gently tap on the tooth now. Let me know if it hurts. Let's start. Ouch! Yes, that hurts a lot, doctor. Ouch! I'm sorry about that. Based on what I'm seeing and the pain you are describing, it appears you have an infected tooth, and the infection has likely spread to the nerve, which is causing the headaches you've been experiencing. Yeah, no doubt. This is called pulpitis, and it's a serious condition that needs to be treated promptly. Pulpitis? Is that why the pain is so bad? What can we do about it? Yes, the pain is intense because the infection is putting pressure on the nerve. The best course of action is to perform a root canal treatment, also known as endodontic therapy. This procedure involves removing the infected tissue from inside the tooth, cleaning it out thoroughly, and then sealing it to prevent further infection. That's it. A root canal? Oh no. I've heard that's really painful. It's understandable to be concerned, but I want to assure you that with modern techniques and anesthesia, the procedure itself is not painful. In fact, it's designed to relieve the pain you're feeling. If we don't treat it, the infection could spread to other parts of your body, leading to more severe complications, including an abscess, which could require more extensive treatment or even hospitalization. That's why it's important to do it as soon as possible. That sounds serious. How much is this going to cost? The cost of a root canal can vary depending on the complexity of the case and the tooth involved. For your molar, the price is around 800. That includes the procedure itself, the local anesthesia, and the follow-up visit to ensure everything is healing properly. Now, if the tooth requires a crown afterward, which is common to protect it, that could be an additional cost. Usually around $600. Wow, that's a lot of money, but I don't want to keep dealing with this pain. And I definitely don't want it to get worse because it hurts a lot, doctor. I understand. It's a significant investment, but it's important for your overall health. We do offer payment plans if that would make it easier for you to manage the cost. And remember, treating this now will prevent much more serious and costly problems in the future. I guess I don't have much of a choice. The pain is really bad, and I can't afford to let this get worse. Let's do the root canal, please. I think that's a wise decision. We'll get started right away to relieve your pain and save the tooth. I'll make sure you're comfortable throughout the entire process, and we'll take it one step at a time. First, I'm going to administer the local anesthesia to numb the area so you won't feel any pain during the procedure. Then we'll begin the treatment. Are you ready? Yeah, I'm ready. I'm a little scared, but I have to do it. Let's get this over with. You're doing great. Just relax, and I'll take care of the rest. We'll have you feeling better in no time. Alright, we're all done. I was able to remove all the infected tissue from your tooth. I've sealed it up, and you'll need to come back in about a week for a follow up visit to make sure everything is healing well. But for now, let's talk about how you're feeling. How's the pain? It's hard to tell, doctor. My mouth feels really numb right now, so I don't feel any pain. Just a little pressure where you were working, but it's definitely better than the sharp pain I had before. That's good to hear. The numbness is from the local anesthesia I used, and it should wear off in a few hours. As the numbness fades, you might feel some mild discomfort or soreness around the area we worked on. This is completely normal and should improve over the next day or so. Don't worry. I see. So the pain won't come back like it was before? No, the sharp pain you were experiencing should be gone for good now. However, you might feel some tenderness in the area for a couple of days, especially when chewing. I recommend sticking to soft foods and avoiding chewing on that side of your mouth. Okay, that makes sense. Is there anything else I need to do to take care of it? First, continue to brush and floss as you normally would, but be gentle around that treated area. You can also rinse your mouth with warm salt water a few times a day to help reduce any swelling. Got it. What about pain relief? Should I keep taking painkillers? If you feel any discomfort later, you can take over the counter pain relievers. Thanks, doctor. I'm glad I came today. I was really worried about the pain getting worse. You're very welcome. Take care of yourself, and I'll see you soon for the follow up. Have a great day. I hope you liked this conversation. If you could improve your English a little more, please subscribe to the channel and share this video with a friend. And if you want to support this channel, you can join us or click on the Super Thanks button. Thank you very much for your support. Take care.